All right, we're gonna get started, everyone. Um, I'm gonna give you all my little spiel here, and then we'll really dive into things. Okay. So, welcome to the Max Group. Um, this is what I've got to say for you. This is not therapy, and is a group of people coming to cope with a variety of presenting problems. Information discussed and shared in this group is intended to support the therapeutic process and increase readiness for change. If you are feeling suicidal or having thoughts of threatening your life, this group is not the place to discuss. Please consider calling 988, getting in touch with your therapist as soon as possible, or reaching out to a loved one to help you access additional resources. We are recording this and it will be available to you on our YouTube channel for you to rewatch. Due to this, if you are not comfortable turning your camera on, that's okay. If you would like to change your name on on your Zoom profile, you can do that as well. With all that being said, groups are most powerful when we learn from each other and share our experiences with one another. So, with that out of the way, let me introduce myself a little bit more. So, my name is Spencer. I'm a licensed therapist at Cache Valley Counseling. I'm also a supervisor. My specialties include couples therapy. I'm a certified EFT therapist, which that doesn't have to mean much to you, if anything, but just a really cool way of doing couples therapy. And I am also a trauma therapist. So I am trained in EMDR, which is a very effective form of trauma therapy, and currently working on the certification process with that, which is a lot of hoops, a lot of extra trainings and stuff, and I love it. Um, so for my Max group today, I'm going to be talking about this question of, do I need trauma therapy? As a trauma therapist, it's a question that I get often. And so I thought it would be helpful to just kind of like share some of my thoughts and some of my feelings about trauma and about how to get help and how to know if you need help, or maybe someone in your life that you know who could use some help. Um, Super open to questions. If anyone has any questions, feel free to type those up in the chat or send me, or kind of just unmute yourself and start talking. I'd love to interact with you if you feel comfortable doing that. Um, so I want to preface this by saying that, again, like as a trauma therapist, I'm aware that sometimes even showing up for something like this of, do I need trauma therapy, could bring up some stuff for you. And so I want to emphasize right now that if at any point during our discussion or our conversation, if you're feeling like you're getting like triggered by something or something uncomfortable is coming up for you, to do one of two things. First of all, you have an out. If you need to just leave the group, please just leave the group. And like I prefaced at the beginning, get in contact with your supports or practice your own coping. Okay. Another thing that I like to recommend, that I recommend to all of my clients or patients who come in to see me for trauma therapy, is something that's called a container. And so I'll just briefly explain this. And if it's something that you find helpful, use it. If not, that's okay too. But basically, whenever we go through something that's hard, whether you call it a trauma or not, it's very common for most of us to kind of like push it down, right? Like we don't want to feel it. And so we push it away, sweep it under the rug, or fill it in with whatever other metaphor you most prefer. We just try to get rid of it, right? Well, I want to honor that need to kind of like get space from it, while also reframing that a little bit in the sense of, let's also give yourself some space to come back to it. We're not just pushing it away forever, but really let's come back to it at some point. And so the container is a visual of a place, a thing where you can put your negative past stuff as a way to kind of like keep them safe, or more importantly, keep you safe from them, but with the understanding again that you're going to come back and revisit them. So this could be anything. It could be a safe, a treasure chest, it could be a cedar chest, it could be a box, a locker, a filing cabinet, a photo album, a bag, a box, like anything. So I want you to just take some time to just think of, what could my container be? Where can I imagine putting my stuff if I need to kind of get space from it temporarily? And then when you've got that kind of image in mind, if some stuff comes up for you that's like negative, I want to invite you to just simply imagine either writing that thing down on a piece of paper, like an imaginary piece of paper, then you put the paper in the container, or to imagine that thing as a picture, like a snapshot image, that you then put the picture in the container. that visual representation is really important because otherwise it can feel kind of ambiguous and hard to deal with, right? And so again, it doesn't need to be complicated. It's just a place where you can imagine placing that stuff for now so that you can deal with it later. And of course, if any of you feel like you need additional support with trauma or difficult past life experiences, please reach out to a therapist who's trained in trauma therapy to help you. And I'll be covering some of what that could look like here in our group today. So, with that covered, I want you to kind of focus in on, for this question of do I need trauma therapy, focus in on actually your present day stressors and or reactions. Because whenever I get this question of do I need trauma therapy, the present is the place to start, ironically. Sure, like some people come in and they kind of self-select and they know like, yeah, I went through this hard thing and I know I need therapy for it. But for many of us, maybe we don't have like a clear cut set of things or thing that we went through, but we know that like current day stuff we're struggling, right? So here are some questions that I would encourage you to at least like consider or think about as it relates to this question of do I need trauma therapy? So the first is, do you have any consistent problems that don't get better despite what you try? Oftentimes trauma can be like seen or known if you're dealing with something on a fairly consistent basis that you've really been putting a lot of effort into doing something about, but it's not getting better. Okay. So there could be an endless amount of examples. Now, I'm not necessarily referring to something of just like addiction, for example, um, but like really anything. Like, let's say, for instance, that you notice that in your parenting, if you have kids, that you tend to get pretty angry, pretty frustrated, like really quick. And that's like a consistent problem for you. That may indicate that you've been through some hard stuff. Again, maybe not necessarily you would use the word trauma, but some hard stuff that are influencing that present day reaction. Maybe, for instance, in your relationships with others, like I'm thinking romantic relationships in this example, you notice yourself falling really fast for people and then sabotaging the relationship. Might be an indication that there's been some past difficulties or traumas connected to relationships that could be influencing that present thing. But again, the thing I'm trying to emphasize is if you have consistent problems, you might consider, well, where did this start for me? Like, when did I start having this problem with this thing? And you might be able to look back and figure out kind of what some of that may be, or at least with the help of the therapist, figure out what that could be. Another classic thing to look for when it comes to like, have I gone through something difficult that might necessitate or that might be benefited by trauma therapy, is if you have any intense reactions that seem excessive given what triggered them. So if like this is the triggering thing or the negative stimulus, right, that you're going through, and your reaction is this big, then most likely, well, not most likely, but like that could be an indication of maybe again some past thing that is influencing that present day reaction. Now, let me clarify, like you've got to be careful to not read too much into things because some things genuinely can just be caused because you're stressed, you're at your wit's end, like that straw that broke the camel's back, so to speak. But looking at these two questions of do I have consistent problems that don't seem to get better despite what I try? And do I have intense reactions that seem excessive given what triggered them? If both of those things feel true for you, that to me is like a good indication that again you've probably gone through some hard stuff that are influencing those present day reactions. There are always going to be other things that influence that and kind of aggravate that existing problem, but this is just where we get curious about asking ourselves like where where does that come from, right? So I kind of have this motto, if you will, of use the present to discover the past. And so again, being able to like look at the present and these things that you struggle with, and then looking back as to like, well, where does this maybe come from for me? And so the process that I recommend for a lot of my clients that I'll share with you all today is to start by identifying like, what am I feeling? Like, what am I experiencing in the present moment that feels excessive or really hard to deal with, right? So that might mean you putting like an emotion word to that thing. It might mean recognizing like what your physical reaction is. like both when I say physical reaction, I mean both what you do, but also what's happening in your body, right? Like maybe you get like this tightness in your chest or this feeling of like a pit in your stomach. Maybe you get like a lump in your throat or a tension or a pressure somewhere in your body. Again, those may be good indicators that, well, they are good indicators that something's going on for you in the present moment. And then another thing to look out for are negative beliefs. So, and again, a lot of these things can come from lots of different sources. And I definitely don't want you to step away from this Max group thinking that, oh, just because I have these things, surely I was traumatized or I have some trauma. That's not what I'm trying to say. It's just about getting curious again, right? But like, let's say, for example, that you struggle with a negative belief of like, I'm not good enough, right? Usually, we're not born with that kind of thought. We're not born with that thought of I'm not good enough, right? I've never met a single kid, like a toddler, who had like a, you know, good upbringing, like present parents, etc., who just out of the cuff, like as soon as they could talk, they're saying, I'm not good enough. No, usually kids are quite full of themselves, actually, which is both endearing and frustrating, right? Um, and so it's our life experiences that when we have enough life experiences where we either felt like we weren't good enough or people told us we weren't good enough or we assume that's what they were saying, that then we come to believe that statement to be true for ourselves, right? So it happens over time. And so a negative belief, usually, again, it's kind of like, think of it like an I statement for yourself, like I'm not good enough, or I'm unlovable, or I'm incompetent or I'm unsafe. Like those kinds of belief systems are usually rooted in repeated experiences that were probably hard or difficult for you. Okay. So those things of like the emotions, your physical body, and those negative beliefs are to help us understand what's happening in the present moment. And then from there, you can take that a step further into discovering maybe what might be those past things that I potentially need to work on by being able to ask yourself, when have I felt this way in the past? And what you're looking for when you ask this question are specific examples or specific experiences, I should say, where that same feeling or negative belief was present for you. So, like to use like the emotion thing, let's say that you're feeling like the emotion is fear, for instance. Asking yourself, when was the last time I felt this kind of fear, right? You might identify a couple of memories or a couple of experiences. For a lot of people who will do this, kind of some more recent things will come up, like things that happened within the last month, the last year. And then I just encourage people, like, if you feel like you can and you're able and it's not too distressing for you to do so, just keep asking yourself, when was an earlier time that I felt that way? When was an earlier time that I felt that way? And just repeating that question to yourself until you get like kind of to whatever earliest memory there is for you. Now, with that, there is a kind of a, I don't know what to call it, a belief, misconception, I'm not sure, that if you don't have early childhood memories, it's because you were severely traumatized in your childhood and that's why you don't remember anything. That is not necessarily true. Is it true that people who experience severe trauma in their childhoods forget a lot of it? Yeah, that is true for sure. But just because you don't remember does not necessarily mean that you had a significant traumatic childhood and you just can't remember it because it was that bad, right? That doesn't work that way. Like for example, just to be like real with you all, I don't really have many memories past the age of like 8 or maybe 7 or 6. Like, but I can tell you, I'm pretty sure that I was never traumatized severely as a kid to the point where I just wouldn't remember it. I've done too much personal work and being with other clients who have gone through significant childhood trauma to say pretty confidently that I'm pretty sure that's not the case for me. Yet I don't have very many memories from my childhood. It's okay, right? We all just kind of store and keep memories differently. Okay, so I wanted to mention that. But again, if you keep asking yourself, like, when was the earliest time I felt this way? Or when was the last time I felt this way? And just keep going back, you might discover more and more memories that are connected to this experience for you that may need to be addressed. And so, as a trauma therapist, the best advice I can give you at this stage right now, if you're considering trauma therapy, is to avoid minimizing your past experience. And this brings me to my next topic, which is what makes something traumatic? So, per the DSM-5, which is the diagnostic manual, right, for therapists, it basically has, it's nasty. It's like a book like this thick. It's horrible with all these like diagnostic criteria and things for like depression or anxiety or OCD, whatever. Well, PTSD is one of those, okay? And if you look at the diagnostic manual for PTSD, to get that diagnosis, you have to experience or witness a near death thing. Okay, so experience it or witness it, or hear repeated experiences of that that are graphic enough in detail that it feels like you were kind of living them. As a trauma therapist, and I see probably like at least half, but probably closer to like 60-70% of the people I see of my total caseload are come in for trauma therapy. And of those people that I see, I think I've seen like, I could probably count on one hand how many people I've seen who have actually had that kind of experience. Yet I see so many people who benefit from trauma therapy, right? And so here's what kind of makes something quote unquote traumatic. Now, I've done a bad job today of using the word trauma because I usually avoid that word because for a lot of people, again, when I say trauma, they think, oh, this big, big thing, right? But it's kind of a mouthful to say, but I do prefer to actually say difficult past life experiences because our perception and perspective make a big difference on if something is categorized or logged, if you will, as traumatic for someone. So the intensity of an experience is obviously going to be part of what makes something traumatic or really difficult, right? But that intensity is subjective to your experience. So what's intense for one person may not be intense for another person, and that's okay. I like to often give people the example of a car crash where if you've got a passenger in that car, right, they're basically going to experience the same accident. Like, let's say it's like a rear collision, right? You're basically going to experience the same accident, but one person could come out of that experience with like PTSD like symptoms, and another person could come out of that with just like a sore neck or something, right? Why is it different? Well, because one person perceived it different. Doesn't mean that the person who experiences those like negative PTSD like symptoms are like weak or something. It's just the way you experience it, right? Like, for example, when it comes to scary movies, like it's like Halloween season right now, I have the tolerance level of like Scooby Doo Zombie Island, if you've ever seen that or heard of that. That's my tolerance level for scary movies, okay? And I know people who watch like all sorts of scary movies and like they can't get enough of that. And I'm like, dude, I watched like Scooby Doo Zombie Island, no kidding you. I will have nightmares. It's not that I'm like weak. I mean, I guess some people I guess might say that, but that's on them, right? But it's just that perception that makes it what it is, right? So that intensity, first thing. Second thing is how ambiguous the experience is. So ambiguity just means how clear it is, right? So if something is ambiguous, it means it's like blurry or doesn't make sense. Kind of like the background that's blurred right now on this image of me, right? It's ambiguous. It's kind of unclear. You can kind of get the gist of what it is, but like you don't really know what's back there, right? Why are kids scared of the dark? Because it's ambiguous. Because they don't know what's there, right? Or what could be there. And so things that are ambiguous kind of tend to be traumatic because the way the brain works is that if something doesn't make sense, the brain forces it to make sense of it, even if that process is completely false, right? Optical illusions are an example of that and how the brain works, right? It just kind of works, but it shouldn't work, but it does because your brain makes it work, right? Because the brain doesn't like things that are unclear. It loves to make things clear, okay? And so if something is unclear, it becomes more traumatic or harder to deal with because now we've got to kind of like piece it together, so to speak, right? So again, personal experience has a big impact on if something is really difficult or traumatic for someone, but also to kind of like add to that, your ability to process it during the event has a big impact as well. Okay. So I'll go back to my car accident example. Let's say in that car accident, you know, the other person who's in the car with you, kind of just tells you like, oh man, like I'm glad that wasn't that I'm glad that wasn't that bad. Like that was a cakewalk, right? So easy. Like I'm like, let's just go home now, kind of deal, right? And totally just like blows it off as like this not big deal thing, right? You're probably not going to be able to work through it as effective if, on the other hand, that person were able to be like, hey, that like really shook me up. Like, how are you feeling about that? Are you okay? And hey, do you want to talk about anything? And, you know, if you get that support, probably going to process it better. Also, if you're able to like give space for yourself, let yourself feel your feelings and work through them, again, more likely you're going to be able to work through it. Oftentimes, though, when something is really hard or traumatic, our body's abilities to work through it get shut off because that fight, flight, or freeze response kicks in and we're not able to process things. We're just in survival mode, right? And that's really good in a lot of situations, but again, makes it harder for us to then work through it in the moment, okay? And that's what then, when it's not worked through, then it becomes kind of lodged in an unhealthy way that then can impact our present, like I was describing earlier. Um, and so, like I said earlier, like in my experience, like anything, literally anything. I've worked with a wide variety of people who have come in for different things, and they can have PTSD like symptoms, even if they don't fit the criteria for PTSD. Okay. And so, again, if you're feeling like you're having a really hard time with past experiences, don't discredit yourself just because it wasn't this like life or death thing. Okay. Oftentimes, sometimes even the simplest and smallest of things can have the biggest of impacts on us. And those are sometimes the harder things to work through because we tell ourselves, I shouldn't feel this way, or I shouldn't have struggled with this in the way that I did, and other things and feelings like that. So I'm going to pause here before I continue. Anyone have any questions that I can answer, or any questions that have come up for any of you while you've been listening? Okay. If anyone does have, again, feel free to shoot. So the next thing I want to talk about is what's called the memory network. And this is important to understand as you consider if you need trauma therapy, because it will help you to understand like how you're accessing these memories to figure out if maybe you need to give some space for them. So um basically, like the way it works is that any type of association that your brain can make, it'll probably make. But that association isn't always going to be a correct one. Okay. So, for example, and I don't anticipate anyone to actually reply to this, so just kind of think it in your head. But when I say roses are red, what's the first thing that comes to mind? If you're like most people, you probably immediately, without any thought, had the thought violets are blue come to mind. It's a classic children's poem, story. I don't know, whatever. And it's just ingrained, right? Oh, like roses are red, violets are blue. Well, the funny thing about this statement is, and by no means am I an expert on flowers, so please, if there is someone out there, don't throw me under the bus on this one. But violets aren't really blue. They're purple, right? They're violet or probably some other color, but probably not blue, right? So why do we say and then associate violets are blue when I hear roses are red? Because there's been an association that's been put up there, right, in my brain, because of, again, repeated experiences and repeated exposure to that thing. This is how your memory network works. And so, as you're kind of thinking back to those memories in the process I outlined earlier, you might notice yourself kind of jumping all over the place. You're like, oh man, there's this memory from like high school, and then I jumped to like kindergarten, and then I went all the way back to like last year, and then I had this thing come up when I was like 4 years old, right? Like you could jump all over the place. And the association can be literally anything, right? Maybe all of those moments you were wearing a red shirt or something, right? Boom, association. That's created for you right there. But the association could be other things too that are a little bit more clear cut, like that feeling, that bodily sensation that you're having, or the negative belief that is connected to the experience. Now, the beauty of the memory network is this: because of how the associations work, when you do trauma therapy, if you work through some of your memories, oftentimes it has a super positive impact on other memories that you have that are negative and or distressing because of how they're related, right? Basically, your brain, as it's processing it, takes that process and says, oh, like this makes sense why I went through this. I'm able to work through those feelings. And here's this other moment where I felt similarly, or where it was a similar experience. Because I worked on this and it's so similar, I don't really need to like work on that because it's similar enough. It's just okay, right? That's how the memory network works and why trauma therapy that's done right can be so effective. Because even though you might feel like you have a lot to work on, in, you know, not that much time, you can see quite a bit of relief because of how the brain and body naturally processes through things and works through them. Okay. So I'm going to wrap up by just again asking this question of, do you need trauma therapy? Do I need trauma therapy? And so I want to answer that question by asking some more questions. Okay. Specifically, what did you notice today, just now? As I was talking about this, did you notice yourself having any feelings come up for you, any bodily reactions, any negative beliefs? Did you notice yourself kind of spontaneously recognizing like um, the certain memories or associations within this conversation that surprised you? Probably something there, if there is, right? The next thing I'll tell you is pay attention to your feelings in your gut. Now, as both a therapist who has experienced anxiety and someone who works with a lot of people who have anxiety, I get how like me saying like listen to your gut if you have anxiety might be like, what? Why would I listen to my gut? Like my gut tells me I'm dying half the time, and why would I listen to that, right? Your body wants to heal. You have to believe that. I've seen that time and time again. And so if the body wants to heal, the trick is getting it into a place where we can slow it down enough to be able to listen to what it's actually trying to tell us instead of just listening to the reactive fight, flight, freeze, or protective stances that we often get stuck in, right? And so, again, like pay attention to your feelings. And if you need help to discern what your feelings are, never hurts to just have a chat with a therapist to say, hey, I've been having some of these thoughts and feelings, but I'm not sure. Like, can you help me with that? And a good trauma therapist will help to slow you down so you can get that sense. Again, the body doesn't lie. If there's a reaction there, then in my mind, something needs to be worked on there. Because again, the body wants to heal. I often tell people, like, if you break a bone, like, other than maybe setting the bone or something like that, you don't have to like put mental energy into healing that bone, right? The body does it naturally. It'll send extra calcium, nutrients, whatever it does to heal that broken bone. It'll work naturally. And I know for someone who may be listening to this who has never experienced trauma therapy before, might be thinking to themselves, like, well, whatever, Spencer, like that sounds great, but that's not going to be real for me or something like that. Like I hear that kind of stuff all the time. And again, as someone who's been in the trenches with people, I really want to reiterate that it works. Your body wants to heal. You just need someone who knows how to work with the body to help it heal. So again, talk with a therapist in doubt and talk to me. Call us. I'd love to chat with you if that's something that you want to do, but get the help that you need. So that was it for today for me. I noticed there was a question, so I want to get to that real quick. So someone said, I see a lot of discussion online about complex PTSD, or what some call refer as CPSD. It said, and then the person says, is that a helpful diagnosis during trauma therapy? So great question. The difference between traditional PTSD and complex PTSD is that complex PTSD is usually associated with repeated childhood experiences or adverse childhood experiences that, again, were repeated and happened over like an extended period of time that then complicate life. And the reason why they kind of use the word complex over just traditional PTSD is because there's not usually like one distinct memory connected to like the person's experience and why they're struggling. And oftentimes too, when people have complex PTSD, they don't even necessarily have a ton of memories. they have maybe like a lot of sensations or physical stuff or emotional stuff. But in terms of memories, sometimes they just have like a snapshot image. Like I remember working with a client who we worked on a memory, and the only image they could identify or the thing they could identify about the memory was this picture of a barn wall, like a barn, like a on a farm, right? Like that's all they could identify, nothing else. Yet that image was connected with so much distress. Through EMDR, we were able to process through what was there to be able to work through the experience so the person could find the relief they were looking for. And so, in terms of like if it's a helpful diagnosis during trauma therapy, the first thing I'll say is primarily like I don't typically diagnose people with things. But to add to that, CPTSD is technically not a diagnosis yet. The powers that be who decide this stuff have decided that it's too similar to PTSD and they're not going to put it as a separate thing. But that doesn't mean it's any less valid, right? The thing that I would encourage you to consider is that like complex PTSD is a very valid experience for many, many people. And if you suspect that you identify with that based on the description I just made, um, you just need to be mindful of the therapist that you're seeing and making sure that they know how to work with trauma when there might not be a lot of clear-cut memories, or it's kind of a little bit more vague in that sense because of the fact that it happened like in childhood and these repeated experiences and things like that. And so like in that sense, that is very helpful, right? That is very helpful. That's a great question. I hope I answered that. Anyone have any other questions? Again, feel free to just unmute yourself or send it in the chat. Any other questions before we end for today? Going once, going twice. Okay. Well, I want to thank you all for being present with me today. Um, I hope that this discussion of like, do I need trauma therapy has been helpful for your personal life or for anyone that you might know who might be struggling, and to just like genuinely repeat that like, if you or you suspect someone you know and love is struggling with this, please, please, please talk to someone, get help. There's lots of resources out there. If you're interested in learning more about trauma therapy, and therapy is not a time like a thing for you right now, a couple of books that I would like to recommend are What Happened to You by Oprah Winfrey, and I think the other guy's name is Dr. Perry. It's a great book about explaining like trauma and why it's important, why it's relevant. The Body Keeps the Score is also a helpful one. It's very heady, like neuroscience-y. So if you like that kind of stuff, great. But it just kind of explains like how PTSD and trauma works in the brain and that kind of stuff. And then Getting Past Your Past is a really great book, especially if you're interested in EMDR as a therapy modality, because it's written by the lady who actually developed the therapy EMDR. And so she covers a lot of the concepts there. And if you're interested in that type of therapy, it can be a good primer to like understand how it works and like even doing some prep work so that when you do see a therapist, you could like kind of jump into it faster, if that makes sense. So those are some resources I might recommend. And again, if anyone wants to talk or chat with me, please give us a call. I'd love to kind of set up a time to chat if that's something that would be helpful. But again, thank you all for joining us tonight, and we hope to see you again on our Max group.